Today, we'll be discussing regarding scrubbing and gloving. Before getting into it, a little brief introductions to start off. The sterile field should be maintained above the upper abdomen of the person in the sterile gown. The area below should be considered unsterile. Surgical scrubbing is a process that removes debris and transient microorganisms from hands and forearms. It reduces the residual microbial count and leaves the antimicrobial residue on the skin that prevents growth of microorganisms for several hours. The surgical gloves minimize the risk of surgical wound infection in patients, and it protects the surgical team from exposure to the bodily fluids. Moving on to the procedures. If this is the first scrub of the day, a 3-minute scrub should be performed. As demonstrated here, the use of aseptic and water is utilized. A nail cleaner is first utilized to remove dirt and debris from underneath the nail bed. Any members who scrub in surgery should try to maintain short nails in order to prevent accumulation of debris underneath them. Next, an aseptic on a sponge is utilized to clean the fingers, hands, and forearms. First, the aseptic is generally applied to the hand, progressing towards the forearm. Next, a more detailed scrubbing is performed by rubbing the sponge over every digit, especially in between the digits. This will remove the microbial organism, especially in the crevices, and allow sterility to be achieved. In addition, the back of the hand should also be thoroughly scrubbed in order to remove dirt and debris from this area. The scrub should be performed starting from the distal tip of the finger and then moving towards the forearm. The WHO recommends scrubbing each aspect of the hands for at least a total of 2 minutes, and the arms from the wrist to the elbow for 1 minute each. Alternatively, a counter-stroke method can also be used. After completing this process, on one hand, the same procedure is repeated on the opposite hand, and after both hands have been scrubbed, the forearm should next be carefully cleaned in a circumferential manner. When washing the aseptic off, it should be done starting from the tips of the finger and then progressing towards the forearm. This prevents the water from the forearm to run back into the hand and contaminating them. For gloving. When putting the glove on sterilely, it can be performed with the help of a group member from the surgical team who's already gowned and gloved, or can be done by yourself. Firstly, putting on surgical gloves on without assistance. After placing the gown on sterilely, the hands remain inside the gown, leaving the cuff of the gown covering the hands. The glove is then placed over the gown, and the hand is then brought through the glove without exposing the outside of the glove to the skin of the hand. This process is then repeated on the opposite side of the hand. The next technique that we'll be looking at is open glove technique. It is not used for scrubbing into an operation. It is used to assist a nurse to put in a Foley. Careful not to touch any of the gloves and completely open up the package. Starting with the right glove, take the right glove, and technically everything on the outside bottom side of the glove is considered the inside of the glove. So it's the inside of the cuff. So holding on to the cuff of the glove and inserting the hand into the glove, let go. Do not touch the cuff anymore because it is no longer sterile. The only thing that are sterile are your palms and fingers. So, with your palms and fingers, take the fingers over the fingers of your gloves and thumb on the cuff. Pull a little bit until you loosen up the glove. Slide your fingers under the cuff. Try and open up a little bit and your finger slides in.